great content in here today. And then to kick things off this morning, we're going to be talking again about creative processes and behaviors. And to start the session, we have Saitta, who's the Chief Digital Officer for Omnicom, David Blair, the Head of Industry Health at Google, and Chris Edwards, who's the CMO at Validic. So let's give everybody a warm hand.
Thank you, Therese. Welcome, everybody. So if this is the last thing you saw last night, be rest assured it is now morning this morning. So hopefully you had a great time last night at the awards. Congratulations to all the award winners. You are indeed at a session on wearing your heart, your brain, and your pancreas on your sleeve. We're going to talk about wearables, we're going to talk about biometric data, and we're going to talk about how we think we're transforming medicine. As Therese said, I'm Saitta. I'm Chief Digital Officer for Omnicom Health Group. What that really means is I use technology and data to help our healthcare communication with our pharmaceutical companies, with patients, and with physicians. I want to welcome David Blair, who is Head of Industry Health at Google. Also one of the top 40 transformers in health this past 2015. So thank you, David, for joining us. And decades of digital marketing experience. Chris Edwards is joining us as well, our Chief Marketing Officer from Validic, who was taking storm over digital healthcare platforms, and also Chief Marketing Officer of the Year for just tremendous growth. So two experts in the space. So let's set a little bit of groundwork. So raise your hand if you're familiar with Internet of Things. Raise your hand. Oh yes, the microphones are working. Wonderful. How many buddies heard of wearables? Okay. So here's some statistics. 500 billion, half a trillion devices are going to be connected to the internet by 2025. There's about 6 billion connected today. It's pretty remarkable, and it's overwhelming. So Samsung's refrigerator will allow me to know if I have enough eggs in the refrigerator. I can get an oven to start my dinner early. I can use Nest, and I can certainly watch my my home electronics. But what's going on as healthcare is absolutely phenomenal. We've got Apple Health Kit, we've got Fitbit, we've got monitors for our hearts, we've got steps. We've moved well beyond steps. And quite frankly, we moved into the world of the WiBo, the wireless body, from head to toe, being able to monitor any part of our body in biometric. And the challenge for all of us as communicators, as technologists, what are we going to do with this? How are we going to transform medicine and medical delivery? Because that's really why we're in health. So I'm going to turn it over to my friend David here, and let's see, David, what do you think? What's going on? Big picture. Wearables are overused.
Thank you, Joanne. Good morning, everyone. Thank you for joining us. I think there's 3 key macro trends I would suggest that we frame the discussion with this morning. The first is cloud computing has untethered us from the desktop and enabled us to essentially be connected from anywhere. And we're now at a point where we are constantly connected, and we no longer go online, we now live online. So the cloud has enabled us to do that. The second piece is what's happened in technology. We now have the Moore's Law is continuing to be rampant. Every 18 months we have the ability to double the amount of transistors on a square inch of a chip. So we are now down to the cell level of the ability to create chips that are the size of a blood cell. So this nanotechnology is very prevalent and obviously has huge impact for us from the medical perspective. And the third piece then is with all of these chips, all of these devices, we now have a proliferation of data. In fact, in the last 2 years, there have been 2.5 quintillion bytes of data. So that's a 2 with 18 zeros after it. Quintillion. So that is going to give rise to the need for machines and artificial intelligence to really take over a variety of things that we do every day. We're starting to see the beginnings of that. We'll talk a little bit about that. So I think those are the 3 key trends to kind of set us up for how to talk about wearables and medical devices.
I learned a new word, quintillion.
That's a lot of zeros. That's a lot of zeros.
A lot of data.
Yeah. Well, I think just to kind of build on a couple of points about trends. How many people, just by a show of hands, like going to the hospital? Okay. How many people care about their, like waking up every day caring about their health? Okay. So those trends really haven't changed. We don't like going to the hospital. Personally, I don't know about you, but after spending some time here, all I would rather do every day is go down by the water in the harbor and eat pizza and drink red wine. Okay, but I can't do that. I actually have to think about my health. And I think some of the things that we're seeing on the global scale, here you have more people on the planet than ever before. You have more people who have access to healthcare than ever before. You have more people who are starting to take an active role in their lives than ever before, using technology. We're starting to see trends with physicians starting to adopt technology before. And as David said, we're starting to see more and more data. And what I get excited about, and again for this audience, is thinking about the patient-generated health data that's coming from wearables. And we'll talk a little bit about that a little bit more.
Thank you. Great segue, Chris, because frankly, there's so many devices. I must get asked like every week, who's your wearable partner? Like there's like tens of thousands. And for the patient, the journey's not so easy. There's lots of devices. Which app do I use with that? I know even myself, if you're on the treadmill or on the Stairmaster, seamlessly connect with my phone. And so I also hear from a lot of patients, frankly, as we work to communicate with them, the device didn't come with the right instructions, or didn't come with the clear instructions, or I can't get the data from my device to my phone to my doctor. So how do we help patients in the journey? And then I want to kind of shift to physicians.
Yeah, good.
How do we help patients in the journey?
Yeah, I think at Validic, we sit on the board of the clinical devices and wearable devices standards, and so we spend a lot of time working with 280 different companies that deal with make devices and wearables. And this is from the fitness tracker to the blood pressure monitor, the blood glucose reader, the spirometer, etc. So we spend a lot of time thinking about how do we make this easier for consumers, because right now it really isn't. One of the things we're starting to see as we work through some of the device companies and their strategies is we're starting to see a shift from wearables to tracking activity to therables. Okay, starting to think about how do you get certain biometric data, key information, heart rate, and just a number of more data off of these devices, which again will allow the consumers just to have access to that data in an easier way. That's kind of what our company does. But what the access problem is actually going to be the key, but we're using our relationships with the device companies to actually start to make it easier for the consumers. We'll talk about doctors in a second, but it's something that we deal with ingestibles and sensors and wearables, and there's some very cool technology that's coming out there so that the consumer doesn't have to come home from the hospital with this big box of remote patient blood pressure monitoring and a weight scale and figure out a way to plug that in. That is starting to transfer to be a lot easier and make it easier for patients.
Chris, can I ask you a question?
You can ask me a lot of questions. We only have, 4 hours today
We only
together?
have 4 hours.
Is that right?
Don't you worry. What is an ingestible?
What is an ingestible? Oh boy.
Somebody's heard of that term.
Yes, ingestibles is exciting stuff. So there's companies out there, one of them is a client of ours, that is actually, they make an ingestible. So again, just a big picture idea, medication adherence. Okay, we might all have parents who do not like taking their pills. Okay, 50% of the people actually don't even take the medicine that their doctor wants. Okay, so medication adherence is a big thing because if you don't take your medicine, that leads to chronic condition exacerbation. That's a big problem, right? So ingestibles might be, you have a pill, pharma company, it would also be an ingestible that is taken with the pill, small as a grain of sand. So essentially it's a radio transmitter that goes to a patch that sends signals to the patch. Is the patient at rest? Is they active? Are they taking the medication? Then that actually information can go to their phone. That information actually goes to the doctor so that the doctor can see it on a dashboard. Did my patient take their medicine? And instead of waiting 6 months to say, okay, now that the patients come back in to be able to see how are they doing, they can do this real time and change doses more on the fly. So ingestibles are going to start to becoming a much bigger thing. It's kind of some scary, cool technology, but it's starting to work. It is.
Cool
Yeah, that's right.
Cool.
Yeah.
David, help us out here. How do we help the patient?
I don't know if I'm going to swallow chips and do all that kind of stuff. So I think from our perspective, this is the opportunity to think about how you use this, and I believe that this is where artificial intelligence is going to come in. So right now we have, I would say, a burgeoning wearables industry, but when you think about it, Fitbit, there's 11 million Fitbits in the world. There's 3 billion smartphones in the world. There'll be 5 billion in another couple of years. So the majority of the universe is going to connect to the internet via smartphone. So all of these different wearables have single sets of data that don't communicate with each other. They're not integrated in any way. So it makes it very difficult for a consumer to try to understand and make sense of all this. So we're not thinking about putting the consumer first and trying to understand what is it that we want this person to try to do and to make it easy to do that. So I think that's where you're starting to see some AI come into play. If you look at Amazon and Apple and Google, the Echo, where you now have the ability for a device to monitor what's happening in the environment. Google Assist, which used to be Google Now, is trying to bring all these different signals together. One of the things I think is interesting in terms of using apps on phones, Mount Sinai is working with chronic asthma patients. They have about 7,500 in a clinical trial. And they're making them use their smartphones to basically pull in geographic data from GPS and start to look at weather conditions, ozone conditions, what's happening in terms of pollen count, pulling all that in as a part of machine learning, and then that data gets all synthesized and transferred, and it gives you an ability then to start to map out all the various things that are happening with those patients. That all gets shared into a central database, and they can start to make sense of it. So that's nothing about wearables or anything else. That's simply monitoring the environment that the individual happens to be in.
You know, let me build on one thing about David's comment about the phone. It's interesting. We're working with a group doing a trial. They have a teen population of girls who have diabetes, and so they were trying to figure out how do we get them to be more engaged in health. So think about teen girls. David and I have teenage daughters, so we can relate to this. Okay, and many of you probably can as well. They tried to give them an activity tracker and a couple of devices to try to figure out how they can monitor them. They said, you know what, we're going to take a different approach. We're going to build an app and put an app on their phone. That the app on their phone was tied to, they just put in a special code when they actually were able to take their insulin. They could not, so their phone was locked. Okay? Think about teenage girl not having access to the phone. Their phone was locked until they were able to enter the special code in. So it was just, again, that's a different trial that people were testing around with. So it's pretty fast. And that would work with my daughter. David, I don't know about you. Give me access to my phone. I can't live without it.
Indeed. Okay, so that's the patient side of things. That's the patient side of things. So how about the physician side of things? So is it really that our wearables, our ingestibles, our immersibles are helping the doctor-patient relationship? Because what we all do, show of hands please, how many folks are in charge of maybe communicating to doctors? All right, and patients at the same time. How do we improve that relationship so that we really can drive down our cost of healthcare? I think the last time I checked, something like $2 trillion are being spent on managing chronic disease. So how do we get the patient and the doctor communicating better? Who's doing it right?
Yeah, I'll give you a couple of examples. Philips is doing it well, Kaiser's doing it well, Sutter Health is doing it well. I'll give you a quick example in the time that we have. We can certainly talk about it more afterwards as well. Right now, with the way that some of these folks are again, we're looking at chronic conditions, for an example, and these are really life-threatening issues that people have. And you'd think somebody would really want to take advantage of the relationship with their doctor and thinking about how to manage that information flow back and forth. And so Sutter Health is an example that is, again, 30 hospital health system in San Francisco, Silicon Valley. What they're doing is they said, you know what, we need to have a better relationship with our patients who have hypertension and heart disease. So we're going to give them a connected scale, blood pressure monitor, and an activity tracker. And said, go live your life. So just let them live their life. And they were able to see that they were able to monitor the data. We were able to work with them on that. The data took a look at it. They were able to help build patient profiles. Okay, this was a have 300 million members that they just were not really doing the patient engagement the right way that they wanted to do this. So they built these patient profiles using the data from hypertension, heart disease, from these connected devices, and they were able to build a lot better brand affinity and relationships. And then they said, okay, well now we're going to take these devices away, part of the program, and they said, no, we're feeling more engaged in Sutter Health. We're feeling more engaged in our relationship with you as the doctor. And so it created a relationship with their health coaches, with their physician staff, and it's just something that they've never seen before. And it was just about using and looking at patient-generated data from some of these devices.
Excellent. It's good to hear the word engagement go on,
Yeah,
right? Because that's part of what we have to do. It's like, how do we engage? And then to see the outcome, impressive for them.
They thought they were doing it just because better care, meaning just the management of that particular population with chronic disease and hypertension, but found that their engagement scores, their satisfaction, and the affinity to the brand went up as well.
We have that. We have Mount Sinai. We have another prediction. I love this quote. When we think about companies that are doing it well, communicating with doctors, with patients, really having a positive impact on outcomes. I love this quote. The leading healthcare company in 5 to 7 years will be a software company. Without a doubt, would anybody in this audience believe that? I believe it. So recently, both IBM and Apple have hired major researchers out of major research organizations out of California, as well as out of Texas and New York, to get on their staff. Get on their staff as chief health transformation officers. So the prediction that a software company will be the next healthcare company is certainly what I believe. High degrees of disruption in our industry, an industry that in general is a little slow to move and advance. So would you concur with that prediction?
I think it's really interesting. I think we're at a really unique time. We have a paternalistic medical society. Jeff Kindler, I thought, who's a former CEO of Pfizer, made a great comparison. You think about the movie studios back in the 30s and 40s. Everyone worked for a studio. The studio took care of you. Everything was done within a studio. You're a director, you're an actor, whatever. The entire industry focused around the studio you were affiliated with. Very similar to healthcare. It's a very closed society. It's doctor-driven. We will tell you what you need to do. I think the rise of consumerism, the ability where our consumer wants what I want, where I want, how I want it, is going to drive enormous disruption in the way that we seek our medical care, and the consumer is going to take much more control over that. So I'm not sure whether it's going to be a tech company. It certainly won't be the medical industry. Somebody from the outside, as you're seeing now, is going to continue to come through and break and chip away at the outside, and ultimately going to come through with a consumer-focused solution that overcomes all the various issues that we've talked about here.
I think you see this quote here on screen, but you also have Frost & Sullivan is a global research and consulting group, one of the largest in the world. They just came out, they stood on stage at the Consumer Electronics Show and have been talking about this for the last few months. They said there are 4 winners in healthcare. 4 winners in healthcare. Based on other research and the market dynamics. One, this is what they said. So this slide they put IBM. They said Walgreens. They said Apple. And they said Validic. Well, that happens to be the company I work for, so that was a happy day for me. So thank you for the applause down there. Appreciate that. So what was interesting is, IBM's been around 100 years, Walgreens been around 100 years, Apple's been around 40 years, we've been around 5 years. I'm not saying we're the winner at all. What I love is that Google's in this space, I love that Apple's in this space, I love that Samsung, Microsoft, these companies, because what these companies do really well is consumer engagement. And they're getting people to think about things differently and challenging the norm. And it's funny, when I was shared that information that Frost & Sullivan, those 4 winners, notably absent was a pharma company, a hospital company. And they just weren't anywhere close. Like, oh man, that's sad. That's sad. But we have to keep going. So I see, technology organizations like Validic and Google continuing to work well, but we want to work alongside the healthcare community. we don't want to just come in and say, we know everything. That's not the intent at all. And I think there's an opportunity for great relationships. I know we're seeing that with our hospitals and payers and pharma companies that we work with. David and Google and their team are seeing similar things.
So what? So what? What can we advise our healthcare communicators? What can we advise our agencies? How many creatives do we have in the audience? Hands up. Any writers in the audience? All right. I won't ask if there's any technologists in the audience, because that'd be me. But so when I think about how does this change what we do and communicate, I think about our creatives, I think about our writers, and I think about our account teams really taking an opportunity to understand the data, to understand the different channels of technology that we have to communicate with from a patient and from a physician perspective. And I see great opportunity. I see great opportunity from healthcare communicators who know messaging, who know brands, and who know how to engage. And so I think the takeaway is around embracing the change, embracing the technology, embracing the data and the power of it, and how it can change how we bring messages into healthcare. So that's my thoughts on the matter.
I like that
What
thought.
do you guys
It's a very
think?
good thought.
What do you guys think? Where are we going from here?
Well, it's funny. I spent a decade working at agencies in San Francisco before being on the client side for the last 10 years. And, you know, data science is sexy. Right? Health data science is life-giving. Okay? This is an exciting time right now. I look at all of the patient-generated data that's getting created from wearables, devices, from the phone. And I think about this through your lens, and I'm thinking, wow, it's going to reveal new insights to creative strategies. It's going to reveal new insights into how do I have help relationships between doctors and patients more, and how do I help them embrace technology? And there's going to be so much richness that we haven't even discovered yet in patient-generated health data that can really. I saw some great work last night at the award ceremony. I saw some great. I didn't realize man boobs were such a big thing, but that was very popular last night. But would love to see the research brief on that one. But I mean, I get that. But I think I get very excited just kind of as a new frontier of thinking about patient-generated health data, because that will reveal new insights that can be used for creative communication campaigns and strategies.
It's interesting. I think it's easy to get caught up in the technology, and I think that what the creative people in the audience do well, as was evidenced last night, is forget about the technology. If you focus on technology and stuff, it's not going to work. You have to put the consumer or the patient at the heart of what you're trying to do. If you think about what has to happen, it's how do you connect emotionally with people to cause them to do things. There's all these proliferation of devices out there. It's very confusing. You also have to think about the millennials are a very different audience than a boomer audience. So the way that you're trying to look at communicating with people is different to that degree. But ultimately, I think it's getting at the heart of how do you inspire someone to do something. And I think we have to get out of this notion of health is something over here we do, and then here's the rest of our life. How do you integrate that all together so you're thinking about that consumer and trying to engage with them? Last comment I make, full disclosure, GSK is one of our clients, but I love what Excedrin did with the VR, where they've actually tried to bring out an experience of a chronic disease. No real mention about the drug or what happens from that perspective, but it's trying to initiate an emotional connection with the families and loved ones and friends, spouses, etc., people that suffer from migraines, to bring that experience to life with technology. So, interesting aspect of what they've done there.
Excellent. Thank you both for a great discussion this morning. We'll be around after. If you have any questions, we'd be happy to entertain them. So thanks for being a great audience as well.
Happy Father's Day.
Yes, happy Father's Day.